वेल नमस्कार आणि येवकार तुमकां गोवा कनेक्टाच्या खाशेल्या कार्यावळीत एवरी डे आमी तुमकां मेळटा वेगवेगळे डिफरंट एस्पेक्ट्स ऑफ दिस पेंडेमीक घेवन फाटले फावटी म्हाज्या बरोबर भास्करबाब असोर्डेकर असले ज्यांनी म्हाका एक बरो एक पर्स्पेक्टीव वेगळो दिलो की वाय शूड बी द प्रायोरिटी दॅट वी शूड वॅक्सिनेट एज ग्रुप ऑफ 25 to 45. ताजेर तांच्यांनी आपली वेगवेगळी कारणां दिली बिकॉज दोज एज ग्रुप्स आर मॅरीड, दे हॅव किड्स अँड ऑल दोज सच थिंग्स. ताजेर बरें डिस्कशन केलें आनी आय थिंक आय नीड टू टेक एन एडवायस फ्रॉम अ पिडियाट्रीक ऑल्सो. तर त्या खातीर फाटले काही म्हयने जे आपले स्वताचे व्हिडिओ करून सोशल मिडियाचेर घालता आनी इट हॅज बीन अ ग्रेट हेल्प टू ऑल द पीपल हू वॉन्ट टू नो अबाउट दिस पॅन्डेमीक, अबाउट दिस कोविड, अबाउट दिस व्हायरस, हाव टू टेक केअर अँड अ लॉट ऑफ एस्पेक्ट्स अबाउट दिस व्हायरस. सो ह्या खातीर आवर्जून आयज आफ्टर मेकिंग अ लॉट ऑफ वेव्स ऑन सोशल मीडिया आय हॅव विथ मी द मोस्ट वॉन्टेड डॉक्टर on social media, that is Dr. Poonam Sambhaji, pediatrician, joining me on this show. Doctor, welcome to the show.
Thank you, and thank you for a very beautiful introduction.
Now, you are a pediatrician, and I mentioned that obviously the age group that can be affected in the next third wave would be the kids. So obviously you coming on this show was that necessary and answering all such questions. So I've kind of made some questions. So let us start the ball rolling. In this pandemic, there are a lot of things. A father maybe goes out to work, a mother, parents goes out to work. There are grandparents at home maybe. The kids are stuck for the last 1 year, more than 1 year. आणि ती भितर घरान आसा. अशा परिस्थितीन आमी आता सगळे जाण शिकला की घरातल्यान भितर सरताना भायर सरताना ऑब्वियसली सगळी काळजी घेवपाक जाय. परत भितर सरताना परत काळजी घेवपाक जाय. वेदर ती वॉशिंग ऑफ हँड, हात पाय धुवप, परत येवन हॅव्हिंग अ बाथ. अशा हितूर सिच्युएशनान वॉट इज द अदर थिंग ऑर मे बी समथिंग दॅट वी आर मिसिंग जी आमी काळजी घेवपाक जाय टू सेफगार्ड our family?
Okay, so basically how to keep our family safe.
True.
आणि आता तुम्ही already म्हणले, you almost covered the SMS, the safe distance, the sanitization, wearing mask, आणि avoiding the social gathering, the social distance. And the third, the last, but the most important is the vaccination, which is coming up now.
Okay.
We have already started the vaccination in the public domain. Already people are getting vaccinated. So first it was started for 45 plus people. And before that, people like who are only healthcare workers. Before then afterwards we came for the comorbid patients. Now we have come for 45 plus. And now also the 18 to 45 has been started. So slowly, step by step vaccination is coming up. People have to accept it. There are still people who are having two ways. Like, there are still people who are having many questions regarding vaccination. But I feel keep all those questions aside. First, take your appointment and go ahead get the vaccine. Because all those who are trying to take appointment will definitely agree with me how it is a little bit difficult to take the appointment on the app because there are so many people approaching to take appointment. And there are slots are given according to the wires that are available. Okay, so we have to be focused towards vaccination. This is the preventive aspect. Okay. Now coming to the second aspect, so prevention is done by this. One is your SMS, which I have been talking a lot about on each and every video of mine. The second is the vaccination, about which also I have started. The third is if at all anyone gets infected in your house or has symptoms which look like COVID, like fever, cough, chest, difficult throat pain, loose motions, body ache, okay, angduka, and loss of smell and taste. The first thing that you should be doing, and you don't require a doctor, you don't require a government to tell you this. You should be home isolating yourself in a proper area with a proper bedroom which is separate from the rest of the room, with the attached toilet, bathroom, and if possible, an attached balcony wherein you can, you can just enjoy yourself because remaining in that room for 10 days in just one room is difficult, and it should be well ventilated, well ventilated.
But
isolation.
Yeah, but I want to ask you one simple question is, आता फाटले, we're still in the curfew mode, बरेचदा कितें जाता, the entire family is at home. Sometimes you have to go out and buy some grocery or maybe some essential stuff that you, आता आम्ही कितें करता, मास्क घालता, भायर सरता वता शॉपाचेर आपले ते सामान घेता आतां एक एकदां घरान घेताना सामान ते वी ट्राय टू सॅनिटायज क्लीन एंड ऑल दोज थिंग्स एक एकदां कितें जाता दॅट वी आर मे बी कॉम्प्लेसंट लेझी आनी आमी कितें करतात ते जे कपड्यांनी आमी भायर गेल्ले आसतात त्याच कपड्यांनी आमी भितर सरता आनी देन वी इंटरॅक्ट विथ आवर फॅमिली सो हाव इम्पॉर्टंट इट इज टू टेक केअर ऑफ द क्लोथ्स टेक केअर ऑफ द मास्क म्हणजे आमी कितें म्हणटा की मास्क घालप सुद्दां यू नो भायर घातला तेच आमी एक एकदां घरानूय घालता. So how important is this kind of etiquettes that we should incorporate and is it correct to जे आमी आतां होल आतां कशें आसा की वेन यू गो आवट कामार आसा जाल्यार आमी येताना सांजचे मागीर यू नो वी हॅव अ बाथ एंड ऑल दोस क्लॉथ डिस्पोज करता. आतां हांगासर कशें आसा की आमी मातसो 5 मिनटांत गेल्लो न्हू 2 मिनटांत गेल्लो न्हू अशें रिजनिंग जाता. हाऊ डू यू सी दिस पर्टिक्युलर एस्पेक्ट?
व्हेरी इम्पॉर्टंट. तुम्ही जसं म्हणले घराच्या बाहेर होता मास्क घालता व्हेरी व्हेरी इम्पॉर्टंट. जेव्हा मास्क घालता हॅज टू बी ऑन युअर नोज अँड अ माउथ. ओके अँड यू डेडिकेट वन पर्सन इन द हाउस who's going to go out. Like presently, I tell you, in my family we are 6 members who stay in one family. Myself, my husband, my 2 kids, and my 2 in-laws. Okay, so in-laws are the senior most. We don't allow them to go out. Children are the smallest, so we don't allow them to go. So it's only me and my husband who manage. So what we do is we prioritize the work. So this is the way everyone else also should do. You know, okay, early morning husband will go out and he will get the food and whatever things have to get. When he comes back, he goes for bath. So early morning, first you get up, you go your stuff, get your stuff and go have your bath. Done. You are supposed to have bath in the morning. So instead you go out and you come and have bath. Okay. Then the rest of the thing, like once he goes for his work, rest of the work, whatever is there, I prioritize it, I make a list and I go only once in 3 or 4 days. So you have to make it a point that you stock things which can be stocked and decrease the number of times that you're going out. And once you go out and come in, please see to that you go directly to the bathroom, wash yourself completely and then come in contact with people at home. This way you are going to decrease the exposure to the rest of the people. And as I said about the mask, okay, yes, please see to it that the mask remains on your nose and your mouth. Okay, most of the time it is always on the chin. Like many times I say, chin se virus hai to aapka mask chin pe nahi hona chahiye. On your
Correct. Very
nose,
true.
on your mouth.
One important question is everybody is talking about the third wave आणि जशें आमी पळयले ते एज ग्रुप जर पळयत आमी सो अशें दिसता आणि ऑब्वियसली यू आर अ पिडियाट्रिशियन तुमचे यू नो यू रीड अ लॉट तुमचोय रिसर्च स्वताचो आसतलो is this virus the third mutant supposed to affect the kids the children's especially in India?
Yeah, so there are 2 groups of people who are debating this right now. Like I think a week back, Dr. Ravi from Nimhans, Bangalore, he came up with this and saying that we expect the third wave to come up somewhere in the end of this year, maybe October, December,
November, yeah.
October, November. We're not sure about the timeline. This is a prediction that he gave. But 2 to 3 days back, doctors, a team of doctors from AIMS and PGI, okay, these are also a very high prime institutes. They came up with a statement saying that no, don't give so much of importance to these predictions which are coming up. Maybe we can hold it with the immunization drive which is going on. So until presently, we should not be focusing too much on that third wave. But yes, we should not be complacent the way we were after the first wave. Like second wave may not come. It is something which is like, you know, people are just making things to, you know, scare the people. So we should not, if the third wave comes, we should be ready. If the third wave doesn't come, you're like, thank God we prepared and it did not.
Okay. Also in regards to this,
I would like to add here. Like, you know, yes, but it does make a common sense in this prediction. We have seen that the first wave affected the elderly. Okay, and you know, people with many comorbid conditions and all that stuff. The second wave came. It has ramped up all our breadwinners, our young people, our reproductive age, or productive age. They have affected them. Now the third, and so we know that the virus is also becoming smarter. You know, so it's also affecting the people who are more approachable. So now these 2 population, either the seniors or the reproductive age group or the productive age group, is becoming either infected and getting the antibodies, or is getting vaccinated and getting antibodies. Correct. So remaining, which is the population, it is the population of children below 18 years, which is the most
vulnerable,
that the virus can approach.
True.
Okay, because it will be the one which is non-vaccinated, and it will be the one which is easily approachable because they have the people at home, if they don't have these etiquettes, they can transmit it to the children.
Correct.
And it would be we parents who are transmitting the children, because children have been good enough not to go out of the house for almost 1.5 years.
Very true,
And
very true.
very differently by them. I mean, you cannot expect children to sit inside the house like this for 1.5 years.
But I think nature teaches us a lot of things. I think the kids have adopted this new lifestyle. बाहेर न what's up, interaction, mask घालून किंवा when you are interacting, mask घालप.
Yeah.
I see a lot of kids who gargle. A lot of adults like us, we have difficulty gargling, but they are so smooth in doing such kind of things. Also, I want to ask you is, let us consider that the third wave is coming. Let us not be surprised that if it doesn't come, great, best. आयली जाल्यार कितें करचें? सो आयली जाल्यार एका फॅमिलीन आपली इम्युनिटी कशी वाडोवची. आयच्या डेटीन तर म्हाका दिसता प्रत्येक फॅमिलीन कोण ना कोण तरी पॉझिटिव्ह जावन गेला आसतलो किंवा कोणाक तरी कोरोना. हार्डली एनी फॅमिली आसा जाका कोरोना जावकूच ना. अशा फॅमिलीन कशें आपली इम्युनिटी वाडोवची, वेदर इट इज गोईंग बॅक टू आयुर्वेदा म्हणा किंवा अदर थिंग्स, मे बी एक्सरसाइज. वॉट इज युअर टेक ऑन इट?
So very, very important is, please do not have this concept that there is some magic medicine which is going to protect me from the corona, or there is some chyawanprash which is going to protect me from the corona. Because even if we see this, all those people who have been endorsing this have also gone to the hospital for corona and come back to. Okay, so whether they eat it or they don't eat it, corona is there. मंडरा रहा है सर के ऊपर. They are just seeing, okay, who is becoming complacent with SMS, I am going to hit that person. Okay, so it is most important the human nature that we have to change. That is the human nature to follow the SMS, human nature to follow and go for the vaccine. And the human nature is something which is the most difficult to manage. You tell a person to do the simplest thing in the life, and that is what he won't be able to do. Okay, and this we have very well seen in the last 1.5 years of this pandemic. Everyone has been telling follow SMS, follow SMS, follow SMS. Still, you find people with mask below the nose, mask below the mouth. You find people moving in the gatherings. You find people going to all sorts of things which we say, okay, you should not do because it will increase your risk of getting the infection. Okay, at the same time, we should also remember that no nation, however rich it is able to tackle this pandemic. You see one nation which could really tackle this pandemic, and which is really high income nation. Okay, so I would just say, take regards to Western country. Okay, no nation was prepared to fight this COVID. No one even anticipated that COVID could hit us like this. Okay, so no amount of ramping up your hospitals, increasing your oxygen supply, increasing your ICU beds is going to decrease this amount of COVID infection if people, public at large, does not take care of their own state. Imagine we are expecting a small population of healthcare workers and the healthcare system and the governance system to take care of a huge population. We are such a huge population, okay? If instead we just turn the wheel around and see that the whole population takes care of themselves by following the SMS, there will be a huge difference. And we see this time and again. Every time there is a curfew place, every time there is a lockdown place, the curve comes down. Why does it come down? Because this is what is bringing down the infection. At the same time, many people will say, yes, Dr. Poonam, you are saying sit at home, what about our economy? We can still have economy by following the etiquettes, right?
Correct.
I mean, in a shop, suppose you take a cloth shop, you don't require 7-8 people jammed up in one small cloth shop. Some people can wait outside till their turn comes. So those etiquettes we have to follow, the public has to follow. We cannot expect someone else to tell us, no, don't do this, no, don't do this. Because by human nature, if someone says no, it is like, no, I am going to do this.
So I think the responsibility lies with us, and I think we should walk the talk. I think that is something that we have to incorporate in our life. हांव जर आनी एक विचारीत जाल्यार let us consider again, there is a possibility of third wave, and the vulnerable sector is the kids. How equipped we are, and what should be the next maybe 1 or 2, 3 months, because we are told that by, as you said, October, November, म्हटल्यार third wave सुरू जातली, and ती third wave कोणाक जातली? Let us consider it is kids. So how do we have to upgrade ourselves, our health sector basically, because there are a lot of challenges, I believe.
Yes, there are a lot of challenges here. Now, see, let me just clarify. I'm a person in a private practice, so I don't deal actively with serious cases who all the doctors in the government sector are seeing, and hats off to them. I mean, the level of stress that they are
Very
facing
true.
is
Very true.
tremendous. Humans who can't even think about such a level of attention. Okay. So, remember, as I said already, no country was prepared for this, so it comes the same for our country or our state.
Yeah.
Okay. At the same time, we should see that I had read some paper through which Dr. Devi Shetty from Bangalore, who's going to head the task force for COVID in Karnataka. Okay, so he had mentioned that just arbitrarily take a number. We have around 165 million children below 12 years in India right now. Okay, today is 30th of May. So
Yeah.
during India, we have right now below 12 years this many children. Just think 20% of these children fall sick because of COVID, and around 5% require ICU. Okay, this calculation will roughly turn up to 1.65 lakh beds of ICU for children. Okay, so that means we should have 1.6 lakh the ICU beds for children.
True.
Presently, status is around 1 lakh, approximately 1 lakh beds are there for adults, and around 2 to 3,000 beds are there for children.
For the kids,
So
yeah.
you can imagine the scale. It's a huge number. Okay, and also remember that now because this is an arbitrary number which I'm telling you. I have read from Dr. Devi Shetty's article. He also mentioned there that no amount of increasing again beds and hospitals is going to help you, because unfortunately beds, hospitals and oxygen doesn't treat the patient. It is the human power which treats the patient. Like the doctors, nurses are multitasking workers, are other health workers.
Correct.
And I would say, doctor, if the doctor puts in 6 to 10 hours of work with the patient, it is 24 hours plus with the sisters and the multitask workers. We cannot work without hand in glove without these other people. We require our nurses, we require our multitask workers, we require all other people who take care of the hospital administration. Only doctors can't take care of this. It's the whole system which has to be ramped up. So you can imagine the level this is all which is quoted by Dr. Devi Shetty. So I won't be able to quote it for Goa because I don't have numbers in Goa as of now.
Okay. Just moving the question ahead, I want to ask you is, you referred this research that is there. अशें जर आसा जाल्यार should be the priority of the government, obviously priority of the government एक जाली, आणि दुसरी आमचे एक स्वताचे अवेअरनेस असपाक जाय की इफ यू आर बिटवीन 25 to 45 years एज ग्रुप जाल्यार you have to take the vaccine because there are people dependent on you. There are kids whom you have to take care of. Is it the right approach that at least forget about the government, you should, because anyways it is open for 18 to 45 age group. So
now,
20,
now as you said, 25 to 45. We are having people married even at the age of 18 years. We are having girls marrying at 18 years. We are having boys marrying at 21.
Correct.
They start family by 20 to 23.
Correct,
Within
correct.
1 year of marriage, they can get children. So
Correct.
they are also responsible family
Very
owners,
true.
right?
Very
So
true.
we have to include 18 to 45 years of age. Now maybe this 25 to 45 must have come up with the Goan standards. Usually we are well educated ladies. We get married at somewhere around 24, 25 years. Okay, so that's why maybe that statement had come. But I think as a whole, we should not think only about Goa. We should think about the whole of India, where people are getting married.
Correct.
Because it's not that only, because see, within some time, again the borders will open, people from other states will come to our state, we will go to another state. So it should be the whole country which is involved, and not only think about a little bit chunk of patient, chunk of people.
Okay, very true. Now, there is this interesting thing that a lot of people, ask us, what is an ideal time? If you are positive, you test, you are positive declared, then obviously you before or during that time you are into home isolation. Now, what is an ideal time frame to have this home isolation? A lot of people have different. आता तर प्रत्येकाचे वेगवेगळे जाला. If you are symptoms आसा जाल्यार ते 10 दिसा 14 दीस करचे पडटा. ना जाल्यार तुका ते 10 दिसान जाता. So if at all for a responsible citizen who has to take care of the entire society and obviously the family that he comes from, what is the ideal home isolation time frame?
So let me tell you, even when we were following the 17 days isolation time, outside Goa, 10 days was being followed, especially in Delhi. Delhi and all those areas. 10 days was already been followed for last year. It was only in Goa that we were following 17 days of
Okay.
isolation. And slowly, I think 3 weeks back or something, the guidelines 10 days. And if you go scientifically, 10 days is the time that the virus is viable. Okay, so even when isolation was for 17 days, we used to ask questions to our seniors like, so why 17 days when the virus is dying after 10 days? We say virus is dying after 10 days. The problem here was some people were calculating their day from the day they get the report. Okay, so sometimes 2 to 3 days that the report is you get the report, it is 2 to
Delayed,
3
correct.
days.
Yeah.
Okay, delayed report. So all this, considering this, they might have said it 10 days, 17 days earlier, but now it is 10 days, and most of the places 10 days is followed.
Okay. Again, next question, as you also suggested that vaccination is something that is important. Every Indian, every citizen eligible as of now should be vaccinated. माझा एकूच क्वेश्चन असा की इफ समबडी इज स्केप्टिकल जाल्यार ताजें कशें अप्रोच करचें वन आणि सेकंडली प्री आणि पोस्ट वॅक्सिनेशन वॉट आर द थिंग्स दॅट वन शुड टेक केअर ऑफ.
So I will answer the second question first. The pre and the post vaccination. Remember, the pre and the post always SMS. That is safe distance, mask, and what is that? Avoid socialization. Even before and after the vaccination. The reason is no vaccine has told you that you will not get infected after getting vaccine. They have said you are not going to get serious effects of the vaccine after getting vaccinated. Serious effect of the infections. Okay, serious. They have said you are not going to get serious effects of infection, that is COVID infection, after getting vaccine. That means getting pneumonia, going on the ventilator, getting the multi-system inflammation and all of the multi-organ failures which happen due to COVID infection. Okay, so no vaccine in the world guarantees you 100% protection. No one, because we cannot, ethically we cannot. Okay, so remember, after getting the vaccination, you do not become a superman, you do not become a superwoman, neither do you have some extra feathers which is going to protect you against the virus. So it is very important that you still decrease your chance of infection by the mask and the safe distance and avoid socialization. Now remember, double masking is what is recommended now. So wear your surgical mask inside and wear a cotton or a cotton mask. It should be a 3-ply mask if possible. Cotton mask outside. Okay, this will decrease down your the infection rate from 70%, which if you wear just one mask, it protects 70%. Double mask protects you around 90%. Okay, so that's a huge difference. So try to double mask. And just for fun purpose, remember first wave we used to say wear at least a mask. Wear mask. It was one mask. Second wave we are saying 2 masks. Now please, public has to take care. Otherwise, third wave will end up with 3 masks. It's going to be very difficult to breathe at that time. Okay.
Okay, I just want to ask one important question with respect to mask. आता तुम्ही very nicely said की पहिले आम्ही म्हटलं की मास्क घाल. आता ते whether it was cloth mask that we had or some other thing, कितें गमछा घाल, खूप जाणांनी खूप कितें सांगलें. आता people are a little more, तांकां कळ्ळो इफेक्ट कितें जाता तो. People who are positive, people who recovered, people who have lost their family members, तांकां आता सगळ्यांक कळ्ळें. So people are taking that additional thing. N95 mask खूप जाण घालता. आता obviously in that situation this we are, a lot of people have lost their job, livelihood गेला. N95 also something that is a little expensive. You can't wear every new mask every single day. असे असताना, how can you approach to this N95, which will obviously help you getting rid of this, staying away from the virus, and also maybe will not damage your pocket. Is there any chance that we can?
When I said that double mask, I did not say N95.
Yeah, I'm just asking की N95 जे आम्ही खूप जण आता सध्या N95 सेकंड वेव्ह खूप जण घालता, खूप जण पळयता.
So N95, usually when it started with the first wave, there was a huge crunch of N95. N95 mask which used to otherwise get for 40-50 rupees, we have bought it even for 400 and 500 rupees one mask. Okay, then we used to get 10 masks like that earlier. And now it has come down. Now the cost is again come down. But during that time, certain guidelines were given to us so that we also don't waste too many masks. So I'll just tell you those guidelines for use of a common man. But definitely it is not 100% guideline. Either it is something that we advise to follow. Okay. But we were told that time, use your N95 mask for the time that you're going to use. After that, keep it air drying, okay, and use that mask after 5 days. So you should have at least 5 masks with you. So I used one on Monday, then second on Tuesday, Thursday, Friday. 5 masks I used. I used the number one mask which I had used on the Monday on my Saturday day. Okay, then Saturday, Sunday, Monday, Tuesday, again another 5 days come, and I hang those masks every time I come in a proper area which will not be approached by anyone. Like children should not go on hanging on that mask. Understand?
Yeah.
So if you dry at the end of 4 to 5 days, no, the mask starts stinking. So you should never use it again because you really can't have a mask stinking around your nose.
Very true.
So you can, the 5 masks will settle, I think, for almost 28 days or so. 30 days it will suffice for 30 days.
So I think it's a good way to go approach for a N95 mask, and obviously it will not damage your pocket also when it comes to costing.
Yeah. At the same time, let me tell you that many people wear N95 mask for N number of times. I mean, you can just look at that N95 mask and say that, oh, this has been used for many, many times. It's so dirty and it looks really dirty.
Okay.
So I would really request people not to do that. If you cannot afford N95 mask, go for a simple surgical mask with a cotton mask over that. That is more cheaper. And again, the surgical mask also inside should be discarded once it starts, 1 or 2 days maximum. Don't use more than that. The people who are wearing it throughout the day, they sweat a lot. So you can't use such type of mask every day.
Is there a chance that you can wear in the second wave time? Can you wear two cloth masks? Can it help?
So that is not recommended.
Okay.
According to CDC guideline, that is not recommended.
Okay.
Recommend a surgical mask and a cotton mask. See, in army, we have these bulletproof jackets which protect you from the bullets. So these bullets are going to protect your vital organs. What are your vital organs? Your heart, your lungs, all that part, or maybe the brain part because of some bullet here. But at the same time, remember the bullet can hit any other part of your body. Okay, so similar is with COVID. How much ever you take precaution as much as possible from your side. Still, there are chances it may hit here and there. So you should be really ready and be mentally prepared to take on if at all you get hit by it. So that's why awareness is important. And I always say, I see what the mind knows. Okay, and that's why you just go on feeding your mind. That's also important.
Okay, I think Dr. Poonam, it was pleasure to have you on this show, and obviously troubleshooting all those queries that I or maybe my viewers had or my friend circle had. या कार्यक्रमाच्या माध्यमांतल्यान ऑब्वियसली ल्हान भुरग्यांचेर आमचो फोकस आसलो आनी जे आमी थर्ड वेव म्हणटा ताच्या खातीर कशें प्रिपेर जावचें आनी डॉक्टर नायसली सेड वन पर्टिक्युलर लायन द सिम्पलस्ट थिंग्स आर द मोस्ट डिफिकल्ट थिंग्स टू इनकॉर्पोरेट इन आवर लायफ. आय थिंक जर आमी ही एटिकेट मॅनर जर मातशी घातली जाल्यार फुडें जे आमी थर्ड वेव जे म्हणटा किंवा सद्याच्या परिस्थितीत म्हणटा आमी म्हाका दिसता इजिली वी वील सेल थ्रू अँड ऑब्वियसली कीप सेफ आवर सेल्फ and more importantly our family and obviously the society that we live in. Dr. Poonam, thank you very much for joining and sharing your valuable thoughts.
Thank you.
Okay, just in case जशें हांवें स्टार्टिंगेक म्हटलें की Dr. Poonam does a lot of vlogs, lot of videos on her platform. So if you want to listen to her, it's at Dr. Poonam's vlog on YouTube, Facebook and Instagram. So ऐकात, obviously तुमची query कितें आसा you can always approach her. ना जाल्यार आमकां approach करा. Obviously we'll try to get back Dr. Poonam and obviously troubleshoot all your queries that are there. हे असलें म्हजें interaction with Dr. Poonam, and we'll be again back on this show with some different guests answering all your queries. तोपर्यंत पळयत रावात Prudent.